Good evening. This is Dale Wetzel. This is the Legislature Today radio program. We're coming to you from the Peacock Alley American Bar and Grill in downtown Bismarck, North Dakota. In our first half hour, we're going to be speaking about Medicaid expansion. This is something that the State Senate gave final approval to today. It's on its way to the governor to expand the Medicaid medical insurance program for low-income North Dakotans to apply to folks that it doesn't apply to presently, specifically single people with an annual income of approximately $16,000 or less. We figure that this will add between 20,000 and 32,000 people to the Medicaid rolls in North Dakota, and these are people who do not have medical insurance. Right now, the Medicaid program in North Dakota has approximately 65,000 beneficiaries, and we have here to discuss the subject Representative Robin Wise, who is a Republican from Hertzfield. He is the chairman of the House Human Services Committee. We also have Representative Kathy Hogan, a Democrat from Fargo and a former Cass County Social Services Director. She's intimately familiar with Medicaid and social programs generally. First of all, before we speak to our guests this evening, I'd like to go through a little bit of what the legislature did today. First of all, there was the Senate approval of Medicaid expansion. It does go to the governor, and he will sign it because it was in his budget to begin with. This bill has a 4-year sunset clause, which means that at the end of 4 years, the legislature will have to revisit this initiative. It also includes language that says that people who sign up for Medicaid are going to be told that they could have this benefit reduced or rescinded if federal support for the program diminishes or is eliminated. And we'll see if that we'll see one, either if the federal support diminishes, and B, if that happens, that if the benefit is indeed eliminated, because that would create quite a Donnybrook in the Capitol. There was also legislation in the House about rural water districts and their territorial rights. The argument was about whether there should be discussions between the House and Senate on the final version of a bill that kind of governs territorial rights of rural water districts versus urban districts that are annexing property outside their present borders as their communities grow. And this is a very contentious subject in the legislature. You might not have heard a lot about it, but it's something that a lot of folks are down here and are very interested in. One of the key issues when a rural water district takes on urban customers or customers within a city is whether or not that water district can handle fire trucks, fire hoses, and provide the proper water pressure for firefighting. This morning there was the House gave a decent burial to a proposed constitutional amendment that it's kind of an example of how things can evolve during the legislature. This was a constitutional amendment sponsored by Senator David Hogue, who is the chairman of the Senate Judiciary Committee. And in its original form, it gave the legislature veto power over ballot measures that are approved by the voters if they affect the state budget by more than $40 million over 2 years. Now, this veto power would have taken effect if 60% of the legislature, after a budget initiative had been approved by the voters, if 60% of the legislature agreed, they could block this initiated measure from taking effect. Well, as this proposal went through the legislative sausage-making process, it morphed into an idea where ballot initiatives that amend the Constitution and also appropriate public money would be barred from the ballot. And the person who was given the job of deciding whether a constitutional amendment that appropriated public funds could go on the ballot was given to the North Dakota Attorney General. The amendment said if a amendment appropriated funds or directed the legislature to appropriate funds, that it would go to the Attorney General before it could be approved for circulation, and if he decided that it did appropriate money, that the ballot measure could not be circulated. Now, this is not a job that the Attorney General wanted to do, have the job of keeping initiated measures off the ballot, and this was defeated rather resoundingly in the House this morning. We'd like to get now to our topic, which is the expansion of Medicaid, and I think it's fair to say that we have two primary factions here in the legislature. The legislature is two-thirds controlled by Republicans. A lot of them don't like Obamacare, and this is part of Obamacare, this idea of expanding Medicaid to make health insurance more widely available. So essentially what you had in the legislature on this issue was a coalition of the willing, people who liked the idea of expanding Medicaid, and a coalition of the reluctant who didn't like it but voted for it anyway. And Robin Wise, who is the chairman of the House Human Services Committee, is a member of the coalition of the reluctant. And Representative Wise, can you tell me why you decided to support this, even though philosophically you don't care for it?
Well, Dale, I guess the overriding reason in the end was strictly economics. The provisions of the Affordable Care Act were going into place regardless. Whether we pass expansion or not, there's several provisions. There's taxes. There's penalties if you don't provide insurance for your employees. All these things are going into effect, which will affect the individuals and employers in the state. Regardless of whether we do the expansion or not, those were going to kick in. Doing the expansion, one, will help childless adults that are most vulnerable. It also reduces costs to our hospitals in the form of charity care and bad debt, and also reduces costs to the employers, who either will have to pick up insurance or pay the $2,000 to $3,000 penalty for not providing insurance for those lower income. And generally, somebody in that 0 to 138% range is not getting health benefits from their employer.
Representative Hogan, how is this going to, in your opinion, help the problem of folks who are uninsured?
It will make a huge difference for the individuals.
Sorry.
Sure, for the individuals that are uninsured right now. In my previous job, I often saw adults without insurance facing cancer, having a car accident, and facing massive medical bills. The number one cause of bankruptcy is medical debt, and typically it's for those without insurance. And so from the human perspective, this will make a massive difference. And again, there are between 20 and 30,000 people without insurance, but I would estimate that probably 8,000 to 10,000 of them face major medical kinds of situations. And so it will have a really significant impact on, and most of these individuals are working class people without health insurance.
So they're poor people who have jobs, but they don't make enough money to buy health insurance.
They don't make enough money, and that health insurance isn't offered as part of their benefit package.
When you were a social services director, Representative Hogan, could you just explain what Medicaid covers? What is it as an insurance policy?
Medicaid is a fairly comprehensive package, in that it covers mental health services, it covers hospitalizations, physician care, all the rehabilitation kinds of services. So it's a fairly comprehensive package. And with the ACA, there's now what's called the Essential Health Benefits Package, which has just been defined so that it's it's like most people have. And it will be consistent with the private providers under ACA. And so with this coverage, you really have health coverage.
And how do you think that this will help hospitals who treat people who don't have insurance?
This is one of the things that has been interesting to me, is that the primary lobby to pass Medicaid expansion really has been the healthcare delivery system, because they are currently seeing these individuals and they are not being reimbursed for them, and they are going after them, but they don't have financial resources. So the realities of it are, you and I who pay for insurance are eating it in insurance premiums. So premiums have gone up because of the uninsured.
Representative Wise, what do you see as the salutary effects of this? I know that it has bureaucratic drawbacks and drawbacks of a number of. I know it has drawbacks, but what do you see as its salutary effects?
Well, one, I guess I would agree with Representative Hogan from the standpoint of it's definitely going to help that core group of low income that do have jobs, generally of some sort. What it will do is it will help the hospitals, no question. They're providers. Estimates where I think just Sanford and Bismarck felt it might make about $2 million difference in their bad debt charity care. So you have that portion that's going to help the providers. The next area I think where it's going to make a difference is with the so-called federal health exchange, the health information exchange, from a standpoint of if these individuals go on the exchange, and approximately 7,000 individuals would be on the exchange if they're not in the expansion, every policyholder in the state of North Dakota has to pick up the cost of that subsidy. So, we're paying additional taxes and different reimbursement rates to pay for Medicaid expansion. That was all part of the ACA. Then, if we don't put them in the expansion, we turn around and then there will basically be a tax charged on each policy to cover the cost of the subsidies. So, economically, it's, to me, even if I may not like provisions in the Affordable Care Act, it's still kind of a win-win from the state's perspective of if we have to pay for it, then we might as well take the benefits. And I realize, there's no free ride. I mean, we say it's free, but we're paying the costs through a lower Medicare reimbursement and certain taxes to pay for that Medicaid expansion.
What are some of these taxes?
There's about 17 or 18 different taxes. There's actually a specific tax that goes on Blue Cross Blue Shield. There's a tax on medical devices. There's a Medicare premium tax that's tacked on there's a whole litany of, not all taxes would necessarily apply in our state, or to certain individuals, but there's a whole litany of various taxes. And then also, I believe it's a 2% reduction in the Medicare reimbursement that our providers will have to absorb when they do Medicare. So those costs are there whether we do the expansion or not. And, to me, then it became a matter of why would you reject it? And the other issue that we found, because of a quirk, and I realize the ACA never assumed that this expansion would be optional, but because of the way it was set up, if I'm making $16,000 a year and we don't do the expansion, I'm not eligible for anything. I can't get any subsidy in the exchange. If I make $18,000 a year, I could go into the exchange and I would pay probably $400, maybe $500 at the most for insurance for a year.
Why is that the case?
Well, because the law's written that, and it was intended to have them on Medicaid. Anybody that makes 100% or less of poverty is not eligible for a subsidy. If you make over 100% up to 400% of poverty, you're eligible for a subsidy through the health insurance exchange. It was the way it was written. I can't explain necessarily the logic, but they wanted them. Part of the reason is they didn't want them in the exchange, that lower income. They wanted them to be part of Medicaid.
What sort of changes do you think could be made to the Affordable Care Act that would make it easier to administer or easier to more palatable?
That's a pretty broad subject. Well,
you're giving your top three.
Yeah. One, I think the exchange has real issues. One, from the standpoint of they aren't even going to be able to implement it now for another year. It was supposed to go into effect January 1st of 2014, and now that's been delayed, it appears, till some point in 2015. So, that's one of the big issues, and the fact that it has to be self-funded, which goes back to the taxpayer. the essential health benefits to me is the biggest problem with Affordable Care Act. One, every policy sold in the state of North Dakota has to meet whatever base policy that the state determines. So there will no longer be high deductible policies available in North Dakota. You know, if for, you know, a lot of farmers, for example, may buy $10,000 deductibles, you know, they're worried about protecting the farm if they have a major claim, but they're willing to eat that $10,000. That won't be allowed anymore. Even if you're not in the exchange, every policy has to meet those. I mean, that would be a change. There ought to be flexibility. If you don't want to be a policy within the exchange, why not let companies sell whatever type of policy they want to? I think that would go, and that's one of the reasons we're going to see a lot of employers shifting people to exchanges, because they'll lose their flexibility of designing policies that may meet their, you know, employees or whatever.
Representative Hogan, do you have in mind any sort of things that you would change about the Affordable Care Act if you could?
I think at this point we are just beginning to implement a system where the average person, the person on the street who really doesn't know public policy, begins to understand that they're going to have access to health insurance. And I think that's a huge change, because insurance is really a large anxiety for many people. Many people continue to work because they need to have the insurance even when they may have health issues. And so I think we're just beginning the implementation process. I'm sure there will be tweaks as we go along, but I don't think we're deep enough into it to know what those tweaks need to be. We've really just got the essential package that Representative Wise was just talking about, outlined in February of this year. So we're just really at the early implementation stage. So I don't think we're at a point where we can say we should change this or that yet. That's why I actually like one of the pieces of this bill that says in 4 years we'll look at it. And I think that's a good plan. The sunset clause, I think, was a good addition, because it's a work in progress.
How do you think folks are going to become aware of this? Because one of the items that was testified to by the Department of Human Services is that they expect people to come out of the woodwork, and that was the phrase that they used. People who are eligible for Medicaid right now,
right,
and they do not realize it, or they haven't applied for it for whatever reason. And there are going to be folks coming into the system who are eligible to be in the system now and are not for reasons of their own. How is this going to, what's the best way to get this going in terms of making people aware of it?
It's interesting. I think the number one way will be with your income tax. When I did my income tax this year, I noticed that it asked health insurance questions, which it previously hadn't done. And that will be one of the major ways of communicating with people to assure that they have health coverage. I think it will also take a fairly major public relations campaign. And I think a lot of organizations like healthcare providers are going to enroll people who come in, and they're going to be active in enrollment in a way that they've never been before.
Would this bill, in your judgment, have been approved by the legislature if it hadn't had the support of the medical providers?
I don't believe so.
What do you think about that, Representative Wise?
I would agree. And I would like to comment, I guess, as far as making people aware of this, especially on the Medicaid portion. CMS is requiring the department has to actively, I guess, recruit, if that's the word you want to use,
educate
those that are eligible. And that's the reason when when you say coming out of the woodwork, that's one of the reasons, because it's, as part of their administration cost share with the feds, they have to actively seek out those that are eligible to bring them in the system if at all possible. So, I assume you're going to see the department having a very active campaign.
I guess the word I would use would advertise.
It's actually something that we've done an aggressive campaign on the children's side. Correct. To enroll people in S-CHIPs and Healthy Steps and the Caring Program and Medicaid. We've had an active outreach program in the children's program for maybe 10 years, Robert?
Yeah. There are things in the schools and everything.
We do aggressive information on that side.
What is this going to do for S-CHIP, which is a health insurance program that's targeted to children? Does it do anything to it? And
well, S-CHIPs at this point will still be there. there are some changes that have to meet the new federal rules as far as income and some of those other issues, but it will still be alive. 5 years from now, it's a good question once everything else comes in place, but they're not preempted. It isn't taken away just because we're going into ACA.
Because I was just wondering, is there any, if you have broad availability of Medicaid, is there a point to having a specific program targeted to children?
Well, Medicaid's a lot lower level yet than CHIPS is as far as income level. So CHIPS allows considerably higher income level than our current Medicaid system would.
How do you think, just try to forecast for me how this is going to proceed. Okay, the law is in place, and it's going to be implemented by the Department of Human Services. What do you think is going to happen now? I'd like to start with you, Representative Hogan.
I think the first thing is getting the basic eligibility procedures and the system, because this will be contracted out, not through the regular Medicaid program. So there's a lot of administrative tasks that have to, and then the outreach, the education. As soon as the system is established for expanded Medicaid, then the education piece. And I think that will be a major initiative, probably not till next year.
Well, I think probably one of the problems now is going to be with this is Representative Hogan's right, we will be contracting out, but most likely the department had planned to just purchase the policies through the exchange. Well, now the exchange won't be up for another year, so we will look at contracting with a private carrier, Sanford or the Blues, and then at that point, once those details, they'll start marketing it to the public.
The gentleman you've been listening to is Robin Wise. He's a Republican state representative from Hertzfield. He is the chairman of the House Human Services Committee. We have also been with Representative Kathy Hogan, a former Cass County Social Services Director who is a Democratic state representative from Fargo. Thank you both very much for coming.
Thank you.
Thank you, Dale. Appreciate it.
Coming up soon, we're going to have Senator Kelly Armstrong, a Republican from Dickinson, and Representative Ed Gruchella, who is a Democrat from Fargo. We're going to be talking about the new driving under the influence law and whether or not it is strong enough for folks' liking. We'll be back in a moment.